Hey, what's going on, guys? I hope you guys are doing good. Welcome to this week's Charlene Live Hospice 101. I hope the week has treated you guys well. Thanks for hopping on. Last week, we talked about Opal and Clyde's story when it comes to hospice and their situation that they had in their circumstance. And today, we're going to talk about someone else, a different story. So if you're hopping on for the first time, welcome. This is going to be every Tuesday around 12:15 from lunchtime. So we're going to talk about specifically what is hospice. There are a lot of people who go through end of life and not have the support and education that they need to understand what it is. So this is what these Hospice 101s are all about. So let's hop on to the journey together. About 1.8 million people in the US utilize hospice, but only about 50% of them actually utilize it specifically. On average, about 18 to 20 days, families or loved ones or patients are on hospice, but the benefit is actually 6 months. And sometimes we see that there's a lot of families who and patients who are on hospice a lot longer. So we want to be able to just educate families and educate everyone on what is hospice. We do home health, we do hospice, we do personal care. But over the last 23 years, we've seen that there's just not enough education, and it needs to be palpable education. It needs to be soft. It doesn't need to be like hard to understand. just like you know exactly how to take your car to get an oil change. It's the same thing. It's just understanding the benefit of it. So this week, we're going to talk about real stories retold. So, every story that we do each week is a story that has to do with the patient that we have served. But for HIPAA purposes, we kind of reorient and reframe the story so that you can understand and sit in their shoes and understand their story. So, today we're going to talk about Mr. Alberto Jimenez. So, Mr. Alberto, his story is amazing, and we're going to walk you through his story when he started, and then also currently and how he's doing right now. If you see that picture of Alberto, he's smiling with his grandkids, and his story is pretty neat. So, Mr. Alberto is actually from Guadalajara, Mexico. He fell in love with football, and he played soccer his whole life. He was actually really good at it. And so, if you guys aren't familiar with soccer, I know in America, football is everything, Sunday night football, but soccer is everywhere outside of outside the U.S. But this year we have the World Cup, so it's going to be pretty neat to see everyone come together. So he was a famous soccer star, and he moved to the United States when he was right around 27. Met his lovely wife, and they had Sophia, his daughter, and so they having your grandpa as an adult kid now, having some help with kids is a big deal. And so he helped out a lot, taking them to school and, going to soccer practices. And he would give, of course, his tips to his grandkids on how to strike the ball and how to hit it with his right foot and his left foot. So having grandpa around is a joy. And so one of the things that they began to notice recently was that he would forget to pick up Mateo from soccer practice on occasion. And it was kind of odd because they were like, that's not like grandpa, like what's going on? So the biggest thing is they saw his concern that he was forgetting to do certain things. And so over the next several years, he would lose his short-term memory quickly. He would have trouble finding his keys. He would just things that were just not like grandpa, and it was a big concern, especially for Sophia, and not having that reliability anymore. Now let's fast forward, Mr. Alberto, and now he's Alzheimer's is actually getting a little bit worse, and he's not able to do the things that he used to do. He's now needing help with feeding sometimes. And not only that, but getting out of bed. And Sophia works in the hospital, but she, is a single mom with raising kids and doesn't have help. And so now, what does she do? So recently, they met with their PCP for a virtual visit. So at that time, Sophia couldn't make it out to go and take her dad to the doctor. So they did a telehealth visit. And the PCP, kind of noticing everything, was like, he's not doing too good. He's declining super fast. Have you guys considered hospice? And with all the cognitive changes that are happening, have you talked to the neurologist? And so Sophia's like, what? Like, what does that mean? Like, what does all that entail? Like, how do I, navigate what hospice is? And like, what does that even mean? And so that's kind of where our story comes. And this is one of the situations and the scenarios that we see a lot is, life kind of hits you in the face and you're like, what options do I have? Where do I turn? What do I go? Where do I go? And when you look at Alberto and you see the joy that he had and the help that he was to Sophia and the grandkids, and now like seasons change and now doctors saying hospice. Now put yourself in Sophia's shoes, right? As okay, well, what do I do? Like, I work at the hospital and I can't come home and help take care of them all the time. And what about the kids now that at that time they were younger, but now they're in high school? Maybe they can come in and help. Like, oh, those are all the things that are going through Sophia's mind. And it's a lot. It's not easy. And so that's where we talk about, where do we start? What is hospice? And so now, if this is the first time you have been hopping on to this live, welcome. What we've been doing weekly is going through hospice 101 situations and scenarios. So we just talked about Alberto and his story, and then we talked about his life and now him needing potentially hospice or understanding from Sophia, his daughter's standpoint, what is hospice and what does that entail. So I'm going to walk you guys through as if I was talking to Sophia, and I'm going to educate specifically on what is hospice to her so that she gets a good understanding, at least the knowledge of those services, so that she can make a good informed decision if that's the route that her and their family want to go through. So, what is hospice? Hospice focuses specifically on pain management, emotional support, also making sure that the loved one's wishes are honored. And so that is the heart of hospice. And specifically, a lot of times hospice can be done in certain areas. It could be done in at home. It could be done at an assisted living facility. It could be done at a skilled nursing facility, depending upon where the family wants their loved ones and their wishes to be. Hospice can be done there. It doesn't have to be at a facility. It can be done at home, which is a common question that we see a lot. And so the biggest thing is there has to be a determining factor for how hospice starts. And that is specifically a diagnosis of 6 months or less to live. And those clinical areas, so which we'll kind of go into it, they have to basically be qualified to make sure that that loved one can actually start hospice. So what I like to do is kind of break down the payer. So we'll talk about the payer mixes. So in this situation, Alberto, he does have Medicare. He did come to the States and he worked and he received Medicare Part A and B and was approved. And under hospice, when you're Medicare age, Medicare Part A is covering hospice care. Now, if you didn't have Medicare, then some insurance plans can't have a contract specifically with hospice, like United Healthcare or Blue Cross Blue Shield or Aetna. If he's non-Medicare age, the hospice has to be network with that specific plan in order to get hospice care. So qualifications are different for every person. So these little emojis that you see is the heart, lungs, brain, blood, cancer, debility is the little old man with the little walker, and just generalized weakness and so many different things. Now each specific diagnosis has a qualification that has to be met. So in Mr. Alberto's situation and his diagnosis is specifically Alzheimer's. Alzheimer's category has several different criteria that has to be met that the hospice will review and see if he qualifies. So let's say he does qualify. Let's just walk Sophia through some of the things that are really important for her to know when it comes to hospice care. There are three parts. Now, there's several parts when it comes to hospice, like lots of different layers. But when you're thinking about hospice, sometimes it's just good to start with the basics so that you can digest it and eat it and understand what it is. And so I like to break it down into three specific categories. That's the care team, that is supplies, DME, and then medications. And so we'll break those down a little bit. So the hospice care team, it's what they call an IDT, an IDG, those teams or groups of interdisciplinary caregivers, clinicians. So you've got a chaplain, a social worker, you have a hospice nurse who is an RN or an LVN. RN is usually the case manager. There's an LVN sometimes, which is a licensed vocational nurse, or an LPN if you're in different areas of the United States. You have a CNA, who is a hospice aide. You have the medical director. Now, these are the core people. There are other parts of hospice, like volunteers or a dietitian or sometimes therapy. But this is the main core of the group that is assigned to your loved one. And so what happens is, like, the nurse is really, think of the nurse as the quarterback. Now, the nurse is the one who creates the care plan, who creates the goals of your loved one when on hospice, guides you through medications, guides you through care coordination. And so then you have a hospice doctor who oversees that care. So now, instead of going to all of your doctors, if the family chooses, which most of the time they do, the best hospices will educate the family on what is the role of that medical director and that doctor. And now that doctor will assume the care and oversee everything that has to do with the terminal diagnosis for your loved one. And that's in a nutshell, a quick summary of what the care team is. And the next part is medication. So now medications are a big topic when it comes to end of life, but the best hospices, what they do, the nurse who's doing the admission or the nurse case manager, what they'll do is on admission, they'll review all the medications, go over what hospice will cover. And usually those medications are underneath what is called the covered terminal diagnosis. And then the non covered items will be picked up by your other insurances. A lot of times, what we see and what a lot of hospices see is that there's just a lot of medications that are ordered by so many different doctors. Now, in Alberto's case, let's say he has a neurologist, let's say he has a PCP, let's say he has a cardiologist, let's say he has a GI doctor, let's say he has all the ologists that you can ever think of, all prescribing in different meds. So a lot of times with hospice is that nurse will come in, reconcile those medications, review all of them based off of how Alberto's doing currently, and see if any of those meds conflict, and educate Sophia and educate the family on, this is my recommendation to probably discharge this medication and really focus on quality of life and not pursuing aggressive treatments and certain medications, if that is the goal of the family, if that's the goal of the patient. And so medications are huge. Now, those are all reconciled, and usually, depending on the hospice, that hospice can assume coordination of those meds and drop ship them to the house or attach them to a pharmacy that you usually go pick them up at and help with all that coordination. So Sophia is not going from CVS to Sam's to Walgreens to several different places that she probably has been going to, and now that hospice can oversee those medications, which is a huge help for families. What we see. Next one is DME and supply. So now hospice contracts with durable medical equipment companies and supply companies to drop ship or bring, depending, sometimes the drop ship or sometimes the nurse or the aide will bring those supplies, which is wipes, chucks, depends. Now all of these are covered. Probably each hospice has their own formulary, which is like, here's a sheet, this is what you can order from. And those are all covered by Medicare Part A. So under hospice, it's a big help for families. It's a big, if you were to go onto Amazon and just click and type in, okay, gloves, and then order 3, and then 3 boxes, by the time you know it, especially if your loved one is having some incontinence issues and you're going through wipes and you're going through gloves like clockwork. And so it is a big help. And these are just a big benefit for families specifically. So those are the 3 categories I kind of like to group them into so that families know the care team, right? Then you also have the medications, and you also have the supplies and the DME. Those are all parts of hospice that's covered. Now there's no cost for those areas. So starting hospice, 4 simple steps. So recognizing it may be time. That's what Sophia and had that PCP meeting on telehealth with her dad. The doctor then says, okay, we should, let's do an evaluation. The doctor sometimes, they don't know specifically in the depths of qualifications. They may just write an order based off of what they're seeing. Now it's the job of the hospice to actually evaluate and see if they meet those criteria, going back to those emojis with the heart and the lungs and the brain and all those areas. Those are all areas that will that the hospice will review the clinicals and see if that your loved one qualifies. So now the Sophia will pick the hospice. So there's so many ways to pick a hospice. You could Google, you could ask the recommendation of a doctor. You may know someone who does that, but it's so important to understand what do the best hospices do, because all hospices provide under Medicare, if they're contracted with Medicare, the same kind of basic foundation. It's just how do they tailor the care to your loved one. And that's what Sophia's job is now, is to figure out, okay, which hospice do I find and that will fit our needs and work with us specifically. The next step is, once you pick, then the hospice nurse or the team will review everything and the admission criteria will begin. And so a lot of times, one of the biggest things that we see is that when we talked about in the beginning, we talked about a lot of families, unfortunately, don't utilize hospice because, number one, education, but also trust. And also it is a very tough word. It's not easy to say hospice in the middle of nowhere. Like if you're at graduation or you're at a birthday party, you're not just going to say the word hospice. It freak people out, and it's true because it's death. But just like you prepare for birth and you prepare for pregnancy and you prepare for those things, there's a lot of education on those things. What I've seen, and I'm sure a lot of hospices and administrators have seen, is that it's just not enough education and not enough palpable education. So that's one of the main reasons why we did this, is just to allow for people to just hop on and to understand what hospice is. So that's how Sophia would start. So in this situation, Alberto was admitted on under Alzheimer's. He met that criteria for needing with ADLs and needing assistance with ADLs, which is activities of daily living. He wasn't able to coherently. Unfortunately, his Alzheimer's got so progressively worse that he wasn't able to, um, you know, put words together coherently. And so these are all some of the small criteria that have to be met in order for someone to qualify. And in his case, he did. So he's good, not good, but he's got support, and Sophia has support. And so now the weight of his disease is not on Sophia. Now she can rely on the nursing team, the chaplain, the aides, and now the aides are coming out. Now the aides that we talked about, the certified nurse assistants, their job is not to sit with Alberto. Their job is specifically guidance on the hospice's case plan or hospice care plan, which is by the nurse. And usually in this situation, you have an aide going out 5 times a week. And usually it's about 30 to 45 minutes, sometimes an hour, focusing on hygiene or focusing on bathing, all with the discretion of the care plan with the nurse and how they go about it. And then he's got a chaplain coming in just to support and get some help from a spiritual coordination side. Some families say no, but it's just offered to families underneath hospice. And now she's got some relief. Doesn't mean that the journey is going to hospice. Doesn't just make it perfect. I like to liken it to specifically when you are on an airplane and you're going through a journey from Dallas to Chicago. The pilot says there's going to be turbulence. Now, knowing that the pilots told you that there's going to be turbulence makes it a little bit comfortable, but it doesn't take away the turbulence. And hospice's job, the hospice team is there to guide you through some turbulent seasons. They're not going to take away the turbulence, but they are going to make it a little bit more comfortable. And in others, hospice lives, we talked about digging into more pain management and those certain things, but this specifically, now each family and each patient, each person has a different story. And so the best hospice is what they do is they tailor to that story, because Alberto just wanted to be at home and wanted to be there with his family, with his kids. He didn't want to go to a facility, and hospice was able to help him with that and help him through that and understand what it is. And so now there's several different areas that, let's say Alberto, let's go back a little bit. Let's say he's doing pretty good and he's having some frequent falls. Now these are kind of like the stages of care at home. You've got home health, you've got personal care, you've got palliative care, then you have hospice care. This series, what we're talking about specifically is hospice, but there are different areas where your loved one may qualify if you're not ready for hospice. And these are the services that we provide, but a lot of agencies throughout the nation do the same. And so you're able to kind of at least go through and see, okay, what does insurance cover? What can we get to provide good outcomes for Mr. Alberto? So, but yeah, that's all we got for Mr. Alberto today. He's doing pretty good. He's still on hospice, and yeah, it's everyone's story is different. And I think we got Tina on the line too. She's our patient care coordinator and our ambassador. At the end of these, what we do is kind of go through some quick Q&A sessions. If you want to talk with us, we are in the Dallas Metroplex, based in Dallas, been around for 23 years. And we focus on home health, hospice, and personal care, palliative care, and veteran care. Let me see if I can hop her in here. Let's see. All right. Tina, you there? Let's see. Let's see.
Can you hear me?
Hey, what's up,
Hey.
team?
Hey,
How's
what's up?
how's it going?
Good, good. Alright,
Sweet,
so we did get a question. So we have a
cool,
question from Tonka on YouTube. She's
sweet.
asking
How's it going,
if
Tom?
she's asking if hospice covers someone who can stay with her dad during the day while she's at work. Is that something that
Ah,
hospice will
great
provide?
question. Great question. That's a question that we get a lot of times. And so when you're looking at hospice, is covered by Medicare or your insurance. Hospice covers those strategic aid visits, which are done by a CNA, and usually it's 30 minutes to 45 minutes, 2 times a week, 3 times a week, sometimes max 5 times a week, depending on the agency. And so hospice is covering that specifically for bathing, for care, but not for sitting at the bedside. And so that's an area of hospice where if you want someone to help at the bedside, that's where you would pay out of pocket. Or if you have a long term care insurance plan already in place, then your loved one can pull down from that and that will pay for those services. Or if they're a veteran, or if, sometimes we see a lot of families, like in Sophia's standpoint, she may call her uncle to come in and help a couple hours a day, or their nieces and nephews, because sometimes funds may not be there, but hospice is still there to relieve and get a little help for families. So I hope that helps. But that's what's covered underneath Medicare and what hospice covers.
Perfect. Let me see. Okay, we also have another question coming from Jahari. She said
Jahari, what's up, Jahari?
she said her dad has terminal cancer, but he also has been seeing a cardiologist. Can he continue seeing both while he's receiving hospice care?
Great question. Great question. So that's where the goals of each family is different, right? So let's say cancer is a primary diagnosis on hospice. It depends on what the hospice has put on their claims in terms of the terminal diagnosis, and then what the cardiologist is billing from a billing standpoint. Now, this is where it gets a little bit specific. So let's say the hospice has terminal diagnosis cancer, the cardiologist has CHF, right? If the hospices have cancer, CHF, and all its comorbidities, depending on what's billed, the cardiologist may not get paid, right? And so a lot of times what we see and that's why hospice education is so important, is that what is the reason why the family wants to continue to go see the cardiologist, and then walking through that to see what are the goals, and then maybe hospice isn't the right step if you want to continue to pursue aggressive treatment. But that's where it's so important to understand what hospice is and someone walk you through it before you start. So that way, when you do start, everyone's on the same page, because it's not recommended by hospices to go see several doctors while you're still on hospice because of those situations, because it gets kind of gray. If that helps, hopefully that helps.
Yes, and then I think I see one more question. Samuel is asking, how is hospice different than palliative care?
Yeah, great question. So right now, and this is 2026, so if someone's watching this in 2030, it may be different, but specifically when you're looking at hospice, hospice is a actual part of Medicare, which is under Part A, right? And so hospice is a benefit that's given to families to provide those services that we talked about today. So a care team, DME, supplies, medication management, all those things are part of a benefit that is now given to someone when they qualify for hospice. Palliative care is an approach to care. So now palliative care is not that specific benefit. It's how do you care for someone and tailor the care that they need. So some areas, some places in Texas, throughout the nation, have a palliative care program. And what they do is that they coordinate either with all of their doctors to make sure that pain is managed well, that they're able to live a good quality life underneath and continue to do aggressive treatment, which probably is like chemo, infusions, right? So you're pursuing aggressive treatment while under palliative care. Now you can't do that underneath hospice. So that's where the differentiation comes into play, is that hospice, you're not pursuing that aggressive treatment. Under palliative care, you can. And so those are the biggest things that we see. The big differences is that the program and how those are done. and how that your loved one is actually going to need those types of care. So hope that helps. Yeah, hospice and palliative care is super complex, but hospice is palliative care, but palliative care is not always hospice.
Gotcha. I think that was all I see
Sweet.
so far.
Great, great. Well, hey, I hope you guys enjoyed this. Hope it was helpful. Feel free to shoot comments, likes, subscribe, questions. Our goal is to just make this more comfortable and easy to talk about, and help you make an informed decision whether hospice is the right choice for you and your loved one, or it's just information you're just trying to get. We'll be on weekly on Tuesdays around 12, and we'll see you then. Bye, y'all.